Welcome to MED-MYSTIFY. So if you've ever looked at a medical chart, a prescription bottle, or, just listened to a doctor and felt like they were speaking an entirely different language, you're absolutely not alone. Today's explainer is designed specifically to translate all that intimidating clinical jargon into everyday, understandable language. We're going to take a seemingly complex cheat sheet of 15 common medical classifications and break them down so that you can understand exactly what's happening in clinical pharmacology. All right, let's dive right into this.
Here's a quick look at our agenda for today. We'll start with a welcome to clinical pharmacology, then move into managing pain and fever, fighting off common infections, and targeting highly specific pathogens. After that, we'll cover cancer and the immune system, and finally, preventing disease with vaccines.
So, Section 1. Welcome to clinical pharmacology. Moving right along to Section 2. Managing pain and fever. Okay, think about your medicine cabinet at home for a second. You likely have analgesics in there. That's just the fancy clinical term for pain relievers, like paracetamol, or even something much stronger like morphine in a clinical setting. You also have antipyretics, which are used to reduce fever. Now, do you notice the overlap here? Paracetamol actually acts as both of these simultaneously, which is a brilliant example of how a single drug can fall into multiple therapeutic classifications. I know, the terminology might sound like it belongs in a sci-fi movie, but these complex terms, they literally just describe exactly what a specific drug is used for. They're just functional labels, really.
Rounding out our common symptom relievers, we've got anti-inflammatory agents. Just like the name implies, these are drugs that reduce inflammation in the body. Good old ibuprofen is a classic, widely used example here. Now, I want to explicitly point out the prefix anti for a moment. In clinical pharmacology, anti simply means against, so this is an agent working against inflammation. Keep this little prefix in the back of your mind because as we move forward, it's going to be your ultimate cheat code for understanding medical jargon.
Next up, Section 3. Fighting off common infections.
When it comes to fighting infections, the medical community has to carefully match the weapon to the invader. It's like a microscopic war zone. Antibiotics treat bacterial infections, like amoxicillin. Antivirals target viruses, like oseltamivir. And antifungals, you guessed it, treat fungal infections, such as fluconazole. Here's a quick fun fact. Alexander Fleming actually discovered the very first antibiotic, penicillin, entirely by accident when mold just happened to grow on a forgotten petri dish. But the key takeaway for us here is that you cannot treat a viral infection with an antibiotic or a fungal infection with an antiviral. The weapon absolutely must perfectly match the microbe.
All right, Section 4, targeting highly specific pathogens.
Now, this is where our mental anchor, that anti prefix, really shines. Ready? Antimalarials, they work against malaria using drugs like Arthemeter. Anthelmintics, these target worm infections, with albendazole being a key example. Antiprotozoals are used to treat protozoal infections, like metronidazole. Antituberculars fight tuberculosis, think rifampicin. And Antileprotics are dedicated to treating leprosy, using medications like dapsone. See the pattern? By simply spotting the word hiding right behind that anti-prefix, you can instantly decode exactly what specialized disease the drug is meant to target.
But before we move on, I want to pose a quick question to you all. How do we treat complex systems? Up until now, we've really just been talking about external invaders, right? Treating pain, fighting bacteria, destroying parasites. But what happens when the issue isn't some outside bug, but a really complex challenge originating from within the body's own systemic functions?
That brings us to Section 5, Cancer and the Immune System.
Now we're entering the heavy-hitting classifications for internal challenges. These drugs interact with the very core of our bodily systems. The first term here is often one of the most intimidating, antineoplastics. But let's completely demystify that right now. A neoplasm is simply an abnormal growth of tissue, which is commonly known as a tumor or cancer. So antineoplastics, like cisplatin for example, are just the precise clinical language for cancer-treating drugs. Doesn't sound so scary when you break it down, does it?
Now let's take a look at the body's defense network. We have two closely related terms here that actually do very distinct jobs. Immunosuppressants, like tacrolimus, actively suppress the immune system, literally dialing down its activity. On the flip side, immunomodulators, like thalidomide, don't necessarily just turn the system down, they modify or adjust its response. It's kind of like the difference between hitting the mute button on your TV versus using an equalizer to fine-tune the sound.
And finally, Section 6, preventing disease with vaccines.
We've arrived at our final
And honestly, arguably our most essential category. Think about it. Every single classification we've discussed so far has been about treating an existing problem. Vaccines uniquely stand out from the pack because they are the ultimate preventative measure. They're medical interventions specifically designed to prevent disease from taking hold in the first place, rather than just reacting to it after the fact. A really prominent example of this incredible preventative power is the HPV vaccine.
Wow, just think about how far we've come in a few short minutes. We've taken an incredibly dense 15-item doctor's notepad and decoded the whole shebang into clear, logical baskets of understanding. From simple analgesics all the way up to complex immunomodulators, you now possess the ultimate MED-MYSTIFY cheat sheet. This once intimidating clinical jargon is now completely accessible to you.
As medical science continues to advance at lightning speed, you gotta wonder, what completely new categories of medicine will we have to name and decode in the next 50 years? Well, that's it for today's Explainer. Please like, subscribe, and share for such more informative videos. Also, add comment topics on which you'd like to see the next video. We will catch you in next one.